Hello everyone, you are welcome to Stamina Clinic's channel. In this short video, I'm going to be talking to us about the importance of vaccines for reproductive health and general health, by the way, because the issue of vaccines is about protecting lives and preventing illnesses. Vaccines have long been a cornerstone of public health and it's been playing a very important role in preventing diseases and also promoting overall well-being of everybody. Now, the importance goes beyond just general health, and it also talks about reproductive health, and the aspect of reproductive health is one I'm going to lay emphasis on today. So I want us to understand that apart from general benefits of vaccines also prevent infectious diseases. There's also herd immunity as well, like that one that we got when there was COVID all over the world. I believe virtually a lot of countries have herd immunity that developed from that. Also, it helps to reduce antibiotic resistance as well, because when diseases are reduced, the amount of antibiotics we use and we abuse will be less. And also, there's a lot of economic benefits for vaccines, because when diseases are prevented, hospitalizations are reduced, as well as long-term complications of diseases. Now, when we talk about reproductive health and vaccines, in reproductive health, vaccines play a very important role in prevention of some reproductive diseases. And these diseases can affect reproductive organs. They can affect the ability to get pregnant and carry pregnancy to term. They can also affect even the babies as well, which we call neonatal health. The first one I'll quickly mention is the HPV vaccine. The HPV vaccine is significantly impact on reproductive health because HPV is a sexually transmitted infection that has been tied to various cancers, which include cervical cancer, anal cancer, and also cancer of the airway as well, or which we call oropharyngeal rather. So vaccination against HPV will not only prevent cancers, but also will reduce things like genital warts as well. So this can be administered before the onset of sexual activity. And with this, HPV vaccine is a pivotal tool in safeguarding reproductive health. The next one I'll quickly mention is rubella vaccine. Rubella which is also known as German measles, right? This can cause severe birth defects if a woman contacts the virus, especially during pregnancy. So the rubella vaccine often gives a part of, we call it MMR, measles, mumps, and rubella, which we give to children. When they are given to children at the young age, it will help prevent them from all these diseases, including rubella, so that by the time they get to childbearing age, this infection will not be able to have impact on their ability to get pregnant and carry their babies to term. Also, something like congenital rubella syndrome, which can cause abnormalities in the babies, would also be prevented. The next one quickly is the Hepatitis B vaccine. We all know about Hepatitis B infection, which can affect the liver and kill the liver and also cause liver cancer or liver cirrhosis. So Hepatitis B vaccine also comes in handy in reproductive health because it will prevent mother-to-child transmission of the virus. Vaccinating women and newborn against Hepatitis B prevents vertical transmission, which we call mother-to-child transmission, and also protect both maternal and infant health as well. In areas of the world where they give influenza vaccine, influenza also poses some risk to pregnant women. And pregnant women have lower immunity, so they have more susceptibility to this infection. And this can have a lot of change. The aspect of pregnancy can have a lot of change on the immune system of a woman. So influenza vaccine is safe and recommended even during pregnancy, and it can help reduce the risk of complications such as preterm labor, providing protection for the newborn so that newborn can stay till the time. So with these few options, a few examples, I'd like to say that vaccines are indispensable in maintaining both reproductive and general health. So they are able to help us prevent infectious diseases, helps us to achieve herd immunity, reduce antibiotic resistance, and also economic benefits to the nation and everybody. Because when the incidence of these diseases are reduced, then the nation also thrives. So we should remember HPV vaccine, rubella vaccine, hepatitis B vaccine, influenza vaccine could be critical in ensuring healthy pregnancies and also protecting neonatal health. And with this, I just love to inform you that Samida Clinics is a place where you can actually stop by to get information on these options, on these concerns, and some of these things would also be checked for in case you need to see us for fertility concerns. So if you come to Samida and we say we need to do a rubella screening for you in preparation for pregnancy, I believe you have some information to back that up. So have a wonderful time, and thank you for listening to this channel. Bye for now.